Welcome. As a new employee, you're about to embark on a whole new path in your career at one of the top independent school districts in Texas. The Katy Independent School District is known for outstanding teachers, administrators, and support staff. People like you. What you do for our students is vital, and in recognition, we're pleased to offer valuable benefits as part of your compensation package. As you'll see, you have a wide range of options from medical, dental, and prescription plans to health and wellness programs, and even free services and discounts. Our goal is not only to give you access to affordable, high-quality medical care, but to help you stay healthy and enjoy life. In fact, speaking of paths, this year we've introduced an exciting new program called Red Brick Health that makes staying on a path of healthy living easier and more fun than ever. You can win points and prizes for participating too. But before we talk about that, let's take a look at the basics you'll need to get started. We have a great website to help you. It's called Benefits Outlook. This is the place to go to learn about your benefits. And when you are ready to make your choices, it's where you enroll. Just go to kdbenefits.org and you are there. The first time you visit Benefits Outlook, you'll need to register. After that, log on anytime to find answers to questions about your healthcare benefits or any other employee coverage. Check it out soon and often. Once you get familiar with this site, you'll see this is your go-to health and wellness information zone. If you'd rather talk to someone instead, just call 866-222-KISD anytime between 7 a.m. and 7 p.m. Monday through Friday. So now, let's get to the real reason you're here. What are your benefits? Well, you have lots of them, including 2 types of medical plans. Each has different premiums, deductibles, and coinsurance for you to consider so you can choose the plan that works best for your life and budget. Here's a quick overview. You can choose from 2 types of plans. One is called the Consumer Plan, and it comes with 2 options, Basic and Plus. The other plan is the POS Premium. All of the plans feature some common basics. Your preventive care is covered 100%, for example. You have prescription drug coverage through CVS Caremark, including a money-saving mail service. You don't need to choose a primary care physician or have a referral to see a specialist. You can take advantage of health and wellness tools through the Benefits Outlook website, all at no extra charge. Plus, you'll have access to physicians across the country, which is important if you travel often or have a dependent child attending school away from home. Let's go through each of the options a little more closely. Here's how the Consumer Plan works. First, keep in mind that the district helps you out with medical care expenses right up front. Each year, the district contributes money into your personal health fund account based on your plan and the size of your family. If you're in the Consumer Basic Plan by yourself, you'll receive $500. If you're covering your spouse or children, you'll receive $750. And if you're covering the whole crew, you'll receive $1,000 in your health fund. If you're in the Consumer Plus Plan, you'll receive $250 more in each category. You can use your health fund for all kinds of medical expenses, and in many cases, never have to come up with the money out of your own pocket. And if you have any money left over in the account at the end of the year, guess what? It stays there, where you can tap into it next year, along with next year's contribution from the district. In other words, it can add up and help save the day in a year when you might have higher than normal expenses. Next, you have an annual deductible. That means you have to pay a certain amount each year before coverage begins. But, and this is a big but, you have your health fund to help cover your deductible. That's what it's there for. And third, as part of the consumer plans, you have major medical coverage. This is your protection against the high cost of health care if you become seriously ill or have a major medical expense. In this case, once you reach your deductible, you pay a share of the cost of your care, which is called coinsurance. That can be a little scary to think about, but there is a limit to the amount you'll ever have to pay in coinsurance. After that, you're covered for the rest of the year, 100%. Here's a tip for you. Don't let terms like deductibles and coinsurance intimidate you. You can find definitions for all of these things on the website too. Look for the interactive guide and click around. Okay, so now you know what's common to both consumer plan options. Now it's time to dig deeper. Here we go. Within either of the consumer plan options, you have two networks to choose from for hospitals and certain specialists: the limited network and the choice network. Got that? It's important because you won't be covered under the consumer plans if you go out of network unless it's a real emergency. The limited network, as you might guess, is more limited. When you need to use a hospital, you are limited to the Memorial Hermann network and to certain specialists in designated categories who have admitting privileges at Memorial Hermann. This network is your most cost-effective choice. If you prefer to have more flexibility in choosing hospitals and specialists, you have the Choice Network, with hospitals and specialists divided into two tiers. Here's another tip to keep in mind. Your costs will always be lowest if you use Tier 1 providers in the Choice Network. Again, this only applies to certain specialists. It has nothing to do with your primary care physician or specialists outside the designated lists for either network. Simple, right? Obviously, no. But just remember, Benefits Outlook is always there with help and guidance. So now that you're completely clear on your consumer plan options, let's go over the POS Premium Plan briefly so you can get an idea of how these plans differ. The POS Premium Plan gives you more flexibility, letting you choose in or out-of-network providers. Just remember, you'll pay a lot more to go out of network, and your monthly premiums will be considerably higher. Here's how it works. As long as you use in-network providers, you have no deductible. You simply pay what's called a copay for office visits and a percentage of the costs for all other care. However, if you go out of network for any reason, there is an annual deductible, and then you're responsible just as you be with the consumer plans for paying coinsurance. It's a lot to think about. That's why it's so important to go to Benefits Outlook to study all the helpful information and compare your options carefully. Remember, you could end up paying a bundle by going out of network, especially if you use an out-of-network emergency facility for a non-emergency. When in doubt in a non-emergency, contact the 24/7 Nurse Line for guidance. It's a free service that can really ease your mind. No matter which medical plan you choose, consumer or POS Premium, you have the same prescription coverage. Briefly, here's how it works. You have a $75 annual deductible for prescriptions, which is separate from your medical plan deductible. You can get prescriptions at any participating pharmacy for a copay, or less if the cost of the drug is lower. And you can save even more by ordering prescriptions through the CVS Caremark link on Benefits Outlook, and even set up automatic refills for maintenance drugs. Another tip, if generic drugs are available for any prescription, you'll pay considerably less to use them. Even better if you choose generic medications for high blood pressure, high cholesterol, asthma, or diabetes, they're absolutely free. So that's the scoop on your medical plan options. The main differences? The consumer plans have the lowest premiums and the potential to save money as long as you use network providers. The POS Premium Plan gives you the most flexibility and predictability in terms of expenses, but the monthly premiums are significantly higher, which means you could end up paying more for services you never need. So now, let's talk about something a little simpler: your teeth, your eyes, your voluntary benefit options. The district offers two dental plans. One, the Indemnity Plan, lets you choose any dentist you like. The other, the Dental HMO, covers dental care in a specific network only. With either plan, preventive care is covered 100%. There is also a vision plan that provides an annual exam and one pair of glasses or contacts per calendar year at no charge. You can set up flexible spending accounts to help you plan and pay for anticipated eligible healthcare and daycare expenses. The amounts you choose to set aside are deducted from your paycheck using pre-tax dollars, which can save you a lot of money. Just be careful when you set them up. There are IRS rules to consider, and unlike your health fund, it's a use it or lose it proposition. If you don't spend the money in your flexible spending account in 1 year, you can't save it for the next year. There are other big differences too, so make sure you understand how each one works. The district benefit plan also offers supplemental life and accidental death and dismemberment coverage in addition to the basic life insurance provided by the district. You can add even more life insurance in $10,000 increments up to $300,000, and there are options to cover your spouse and children as well. As a new employee, you can enroll for up to 3 times your annual salary in supplemental life insurance without answering any medical questions. Anything over this amount, or $200,000, requires evidence of insurability, a fancy way of saying a health questionnaire. And if you enroll in supplemental life insurance now, you can increase your election by an amount equal to your annual salary during the annual enrollment period, usually in the fall. And just when you thought there couldn't possibly be more, there's more. There are voluntary options for several more special plans, including coverage in the event that you become disabled. The disability plan pays 66 2/3 of your salary after a waiting period if you are disabled and unable to work due to an injury, illness, or pregnancy. You can choose from 2 waiting periods, either 14 days or 90 days, and you're covered without having to answer any health questions. There's even a plan that pays a benefit if you're diagnosed with cancer, and a legal plan which offers hundreds of free and low-cost personal legal services. You never know. But enough about illness and legal issues. Let's get to that path to health and wellness we alluded to earlier. Red Brick Health is a brand new benefits outlook program available online or on your smartphone, designed to inspire you to get fit and healthy. Red Brick Health takes a different approach than programs you may have seen before, giving you ideas, feedback, and rewards to keep you on track and motivated to succeed. One of the first and most important steps is taking the confidential online health assessment available through the Benefits Outlook website. It's so quick and easy, it's actually fun. The results of your health assessment help create a personalized health map of follow-up activities to start you on the road to better health. Red Brick Health even provides coaching online or over the phone, as well as incentives for setting goals and participating in health-focused journeys designed to help you reach them. In fact, there are lots of healthy activities you can take part in to earn drawing entries for quarterly prizes like gift cards and lots of other great stuff. And if you earn more than 100 drawing entries in a quarter, up to 50 of the extras will be rolled into the next quarter, and you will be ahead of the game. The details are spelled out in your 2013 Benefits Guide, available online. You can also take advantage of the My Health program, which offers even more health and wellness benefits at no cost to you. There's a 24/7 nurse line we mentioned earlier, offering free consultation with a registered nurse about anything health-related and at any time of the day or night. There are disease management programs that can help you make dramatic improvements in dealing with chronic conditions, such as high blood pressure, high cholesterol, and more. There's the Diabetes America program, which coordinates specialized diabetes care, education, nutrition, and medication management. Again, absolutely free. And if you ever need to talk with someone about a life challenge or crisis, professional help is a phone call away through the confidential Employee Assistance Program. Many of these special programs and offerings are coordinated for you through Red Brick Health online at Benefits Outlook, which is also where you need to go to enroll. Again, once you register on the site, just click here and follow the prompts. You have 31 days from the date that you're eligible for benefits to submit your elections, so please don't put it off. As you go through the process, remember, you can look right here or here or here if you get hung up and have questions. Speaking of questions, here's a good one. How do you know if you're eligible? As a general rule, you can participate in the Benefits Outlook program as long as you're a regular employee and a contributing member of the teacher retirement system. If you're retired from TRS and rehired by the district, you may also be able to participate. Your spouse and children can participate too, as long as they meet certain basic criteria. Again, Benefits Outlook is a great resource for that kind of information. Another question you probably have: when does coverage become effective? Your benefits are effective the first of the month following your date of hire. If you're hired on the first of the month, your coverage begins that day. Premiums are deducted from your first available paycheck after you enroll, which means you might see a larger than expected deduction that first time just to get you caught up. Also, as time goes on, things change. You might get married, for example, or add a child or two to your family. Major life events may call for changes to your benefits. Just go back to Benefits Outlook at KISDbenefits.org to see how and when to make those changes. To make it official, you'll need to call Benefits Outlook within 31 days of the event. And speaking of official, that's officially all there is to say, for now. Just remember, if you have any questions at all, count on Benefits Outlook for the latest information or call us at 866-222-KISD. The Benefits Outlook customer service team is ready and willing to take your call in English or Spanish from 7 a.m. to 7 p.m. and help you feel great about your benefits and your choice to join the Katy Independent School District, one of the top independent school districts in Texas. Thanks to you.